Hello, everyone, and welcome to the today's session of Screen Time Guidelines for Children, which is brought to you by Apollo Cradle. This is something a very important topic which each parent is looking forward to hear upon, and we have a very well-known Dr. Vivek Chaudhary who has come to speak on this topic with us. Some a desired coveted topic by most of the parents because COVID has really taken a problem and hit on this, and kids are always hooked on to any of the electronic gadgets. So we need to know, understand how to take it up from there. So Dr. Vivek Chaudhary is a consultant pediatrician and neonatologist associated with Motinagar Center of Apollo Cradle. And to give a brief background about our speaker today, Dr. Vivek Chaudhary has done his MBBS and MD into pediatrician, and he has done his DNB into neonatology. And he's working with us as a consultant neonatologist and pediatrician. Welcome, doctor. Welcome to the session. We are looking forward to hear from you some tips that could help all the parents here to reduce the screen time for our kids. So the screen is all yours. I'll be there at the back.
Yeah, thank you so much, Aarti, for a good introduction. As rightly pointed out at the introduction, that screen time and with the COVID pandemic, we all parents, including me, understand that screen time has become an essential part of child's education. But again, balancing screen time and other activities remains an important aspect of child development because this is a growing phase and without proper parental monitoring and understanding of the screen time implications in children, this may have disastrous effect on complete health of the child. So I'll be talking briefly about the screen time guidelines which we should as parents be following or which we should be implementing for our children. Albeit understanding that the last 2 years would have been difficult without screen for the proper education of the child, and we also all parents should inculcate the habit of digital hygiene, which once I finish my talk you would understand that it's not that possible, but yes, we should start trying for now, and maybe in due course we would be able to meet this guidelines. One second, I'll be talking briefly on these things, and I would appreciate any questions because we cannot cover the entire issues which we parents or pediatrician face with the screen using children. Now, just to introduce the topic, what does screen time mean? It's the total time spent per day in front of screen, which may be a TV, which may be a computer, which may be a laptop or a iPad or any visual device for that purpose which is used. So the total time spent per day we consider as a screen time. Now, as we talk of a balanced food, that having healthy food leads to healthy nutrition, and unhealthy food will lead to disease state. Similarly, we call screen time as good screen time, which are used for the healthy purposes, and unhealthy screen time would be which can have a disastrous effect on the child. So this is a balance. Now we need to understand we have to strike a balance between good screen time and lead to healthy development of the child. Now the second question comes to a parent's mind is what is the right age or what is the limitation of screen time in children? If you go through any guidelines, if you talk of Indian Academy of Pediatrics or American Academy of Pediatrics for that purpose, so children below 2 years, they should not ideally have any screen time. Occasional video chatting with family, friends, that's acceptable, but as such, below 2 years, there should not be any screen time. If you're talking for children between 2 to 5 years of age, the screen time has to be limited to 1 hour per day. Now, this 1 hour screen time again has to be parental co-viewing and co-monitored. So you should understand the parents should understand the content and the implication for that screen time. The AP goes a little further and says during weekends. So weekdays it's 1 hour per day, and towards the weekend this can go up to 3 hours per day, considering the other association of the child. Now, above 5 years or older children or adolescent, now we have to strike a balance. Now, what is this balance? This balance means the child should have adequate physical activity. This means at least 1 hour of physical activity or playtime. Most importantly, they should have adequate sleep. Now, duration of adequate sleep varies with age, but for older children and adolescents, they should have at least 8 to 9 hours of uninterrupted sleep at bedtime. There should be proper timing for meals, school activities, family time. If all these are accounted for and this goes on well, and a strike between the screen time and this can be made. There is no specific hours of watching for older children, but again, this balance has to be met. Now, the second thought comes: what are the advantages? I told it's healthy some way, it's unhealthy some way. So what are the advantages and what are the disadvantages? Now, if you look at the health hazards, so screen time can have implication on physical health. It can have implications on mental health, social, and scholastic. If you talk of physical health, the implications are obesity, sedentary lifestyle, maybe headache, eye strain. We during the COVID times, we had seen lot many patients, children coming with eye strain, headache. These were the issues with excessive screen time. Now, again, coming to obesity, if you talk of management obesity, only reducing screen time during meal hours, this can bring down the incidence of obesity by more than 50%. So, again, physical health is ascertained or is affected by screen time. Coming to mental health, with the COVID-19 pandemic, even every data from even across the world shows that the mental health problems have increased to maybe tenfold in children. This mental health problem can be aggression, depression, anxiety, aggressive behavior. So multiple mental health problems, FOMO, fear of missing out, fear of being left out. So there are multiple issues in older children also with uh, excessive screen time or unhealthy screen time. Thirdly, I spoke about social. So this reduces the chance of family bonding and reduces socialization. And even scholastic, there may be implications on the academic performance of the child. So there are a lot many disadvantages of unhealthy screen time. Now, if you look at the positive side of screen, so it allows or gives a platform for a child for learning and knowledge. Now, if you talk of our old days, reading books or only text were the only way of you acquiring knowledge. Now, with good sites, whether you can have updated knowledge of anything. So it provides a good way of learning. Even we say that visual learning sometimes the way digital platforms the educational platforms have been made, they have made education much easy and much more interesting for the child. So that way it's healthy. It also provides a platform for the child to showcase their talents, their creativity. If it's used for creation of art, music, anything, showcasing talents. Again, it forms a network for socializing with friends, family, communicating or getting connected. As we understand, people stay in different places, friends, family, relatives, they all stay across the globe, and you can stay connected. So that's the implication. Whether we have so many advantages, we have so many disadvantages, and that's why we call it. We have to strike a balance between healthy and unhealthy screen uses. The second aspect comes to most parents. Then what's the right age to introduce? As I said, the guidelines have been very specific, below 2 years, 2 to 5 years, and more than 5 years. And also the social networking or platforms also provide the space for child to showcase their talents. Then, as a parent, we say that we should maintain certain digital hygiene. Now, what is digital hygiene as such? As we talk of sleep hygiene, health hygiene, COVID hygiene. So there is also digital hygiene. So there are certain principles of digital hygiene. So most importantly, there should be always a very conducive environment at home. The child should have a very nurturing environment at home. He should not feel that digital platform is the only way of my communicating. There should be parents should always be inculcating that nature of secure environment, that they should feel free. Secondly, the second few rules which apply to digital hygiene is that you should follow the norms, that you should have adequate amount of physical activity, which I already mentioned, adequate amount of sleep, And there is an important rule, even suggested by IAP, the Indian Academy and American Academy, that screen should be switched off at least 1 hour prior to sleep. So now, there are certain blue lights or LED lights which are emitted through screens, which may disturb sleep. So at least 1 hour prior going to your sleep time, all screens should be switched off. Again, parents play a role model for the children. As parents, if we do not limit our screen usage, or we do not follow a good digital hygiene ourselves, then our children would not be following the same. Thirdly, there should be rule of digital free zones or digital fasting. Now, digital free zones means certain areas in the house or places there should be absolutely no screens or no digital time, like bedroom, dining area. So again, pointed out the most important physical aspect or side effect of screen time is obesity. So there is a golden rule that you should not be having any screen in your dining area. No TV viewing, no mobiles, or no even there is a tradition of watching certain news or while having food or certain updation. But yeah, dining area is one area which should be totally digital free zone. Kitchen, while driving vehicles. So these are the places where it should be completely digital free zones. Then there is a concept of digital fasting. That means there should be certain times of the day where you follow that no one in the family, including adults, children, no one is using any digital devices. And plus there should be again, I pointed out that there are issues of eye strain and headache. So there is a 20-20-20 rule for this rule says that after every 20 minutes for at least 20 seconds you should look at an object 20 feet away. So this decreases chances of computer vision syndrome, which I said leads to eye strain and headache. Plus, there are proper position techniques for while viewing your screens, that you should be sitting straight with your back rested, your legs touching the ground, your arms set parallel to the ground, and the upper part of the computer should be at the level of your eyes. Or the upper part of the screen should be at the level of your eyes. Now, these are certain rules of digital hygiene which you should be incorporating. Plus, the most important aspect for parents for their children is there should be co-viewing or at least monitoring of your child about the contents which is being watched. Certain video games which are very aggressive, which leads to violence nature in the child. Again, those has to be monitored. Most social media platforms have their guidelines for age specific guidelines when you can use. Just for example, Facebook, Instagram, Twitter, they have set an age limit of 13 years for using those social networking sites. For WhatsApp, they have set up an age of 16 years maybe. But again, I said this forms a media for showcasing your child's talent, and this is below that age. It's under parental usage for showcasing the talent of the child. So this is the overview about screen time guidelines, which I wanted to highlight. So to summarize my points, the screen time guidelines are very specific: less than 2 years, no screen time; 2 to 5 years, 1 hour per day; above 5 years, balancing with other activities. We should follow a strict guidelines for digital hygiene. I pointed out certain important highlights of digital hygiene we should be following. Parents form a role model for the children. They should showcase their child as a role model of how to be using digital platforms. Plus, you should follow the rule of digital free zones and digital fasting. With this, I sum up, and I would like to take up any questions by you. Thank you so much.
So there is one question where the parent is wanted to know that how does she know that her child is addicted to media? Is there a way of, are there any signs
Yeah,
and symptoms
see,
for that, and what is it?
as for yeah, thank you. That was a nice question, but yeah, you need to understand for any addiction, for any even for a drug, we can understand. So, if your child has an excessive craving for that using digital platform, Even after your repeated refusals, he does not listen, or there is excessive craving. Despite having poor performance in the school, or scholastic performance has decreased, still he cannot uh, reduce it. There is a violent or aggressive behavior, revolved by the child. Then you can understand to some extent that your child is addicted to media. And with other de-addiction programs, this also will require behavioral therapy, at least by the developmental pediatrician, to de-addict this child. So by this, you can understand your child is addicted. So for any addiction, similar, we can understand the addiction with media is there.
Right. Thank you, sir. No more questions now, but your session was really wonderful. I mean, I'm sure there would be many questions in parents'
Yeah,
mind
I
also,
understand. I kept
which,
it short because
yeah,
my point was to at least sensitize the parents to the issue of
correct,
screen
correct,
time.
correct, correct.
This is one. And we understand now after listening, maybe we do see an office practice that parents come with some questions regarding screen. We try to encourage them to ask, and we try to help them with this screen time problem. But we understand whether we can call it a necessary evil. But again, as parents, we need to understand. My point was I wanted to sensitize parents regarding this screen time. So that's why I've chosen this topic. And maybe once parents do post later also, we can have a second session on this, and we can have an
Absolutely.
extended session
Right,
on this. That's
correct.
why I try to keep it very short so that they are at least sensitized to the issue of screen issues.
Right, right. So I mean, I'm sure there are many other questions, and I guess then another session on a similar topic, like what should be a timeline, or for how much time should a children in particular age group should be given, and if you can focus more on that, maybe that would be a good topic for in coming days,
We can
and
take
we
up.
would
The
look
idea is to
forward for
sensitize parents.
that kind of topic. Yeah,
Okay. Thank you. Thank you so much.
yeah. Thank you so much, sir. Thank you for a wonderful session. Thank you.
Thank you.